Hey everybody, it's Dr. Eric Balkavage. We're back for another edition of Thyroid Thursday. And today I want to talk about hypothyroidism in your gut. And I'll probably do a number of these, but let's say this is part one. So remember, we talk about hypothyroidism, we talk about two causes of hypothyroidism. There's cellular hypothyroidism, which means there's not enough thyroid hormone reaching your gland. That's what triggers your hypothyroid symptoms. And two is glandular hypothyroidism, where the gland is not making sufficient thyroid hormone. Now, the number one cause for that is Hashimoto's thyroiditis. It's an autoimmune attack on the thyroid tissues. Now, the number one cause, or if you look at the literature and the research, is thought to be that there's loss of cell tolerance, which is what we're going to talk about today, and the gut's role in loss of cell tolerance. But really, I think the number one reason is it's a secondary response to some type of danger, okay? And that definitely goes along with what we're going to talk today, okay? So other causes that you can have glandular hypothyroidism is too much or too little iodine, because iodine is critical for thyroid hormone production. It could be toxins that block iodine transport or cause damage to the thyroid gland. Chloride, fluoride, bromide, even excessive estrogens. There's in xenoestrogens, lots of things that can trigger it, and we've done a bunch of videos on those already. And then toxins can do it. We talked about that. And then organisms like viruses and bacteria can cause that an autoimmune attack and thyroid gland dysfunction, and that kind of goes along with our secondary response to some type of danger. So let's talk about the gut's role in causing hypothyroidism, especially Hashimoto's. 70% of the immune system surrounds your GI tract. So the GI tract health and function is critically important. It's the one place where we put all kinds of foods and things into the system, and they have the greatest ability to get into the peripheral body. The immune system is constantly in a state of like checking out your food proteins, making sure that, hey, those are proteins that we're not reactive to, those things are good, and keeping surveillance. They're keeping an eye on the bacterial balance, making sure that problematic bacteria don't overgrow. Even the commensal bacteria, what we call the good bacteria, if they need to be stimulated, they get stimulated. If they need to be knocked down, they get knocked down a bit. And the immune system is also monitoring the toxins that are produced by these bacteria. Both commensal and pathogenic organisms can produce toxic substances that, as long as they're kept within a certain range and they stay within the GI tract, it's not a big deal. But if those levels of toxins get excessive and get out of the GI tract, they can really create a number of issues, especially autoimmune thyroid disease. And the GI immune system is always producing some products, enzymes and things to help manage these things. And butyrate's a great example of that. You eat dietary fiber, the bacteria in your GI tract increase a product called butyrate, and then butyrate keeps one of the bacterial toxins called LPS under control. And LPS is associated with all kinds of issues. And LPS stands for lipopolysaccharides. So anytime there's a dysbiosis or imbalance of the good flora, it doesn't mean you have to have pathogenic organisms, what we would typically associate with GI disease, but even commensal bacteria are supposed to be in the GI tract. If they overgrow or undergrow, it can create a state of what we call dysbiosis, just an abnormal balance of the bacterial flora. And the dysbiosis in the gut biome can cause an increased activation of the immune system. The immune system can get upregulated. And when the immune system is upregulated, it's thought that that's when we lose self-tolerance. That the immune cells, instead of kind of managing or knowing what our own tissues are and not attacking those, actually loses tolerance to those tissues and actually starts to attack our own tissues, okay? And when we start attacking our own tissues, we produce these things called self-antibodies. And the tissue that's most sensitive to that is really the thyroid gland. And I'll talk about why that is in future podcasts. When the immune system is overactivated, that's when we typically see increased food sensitivities, increased food intolerances, and increased likelihood of allergy responses. And so what could cause dysbiosis, right? What's causing this imbalance in your gut flora? Well, it's a lot of our lifestyle things, emotional stress. So if you have a lot of emotional stress from family, finances, relationships, poor self-thinking, that can change your gut flora. The emotional stress increases your fight or flight hormones. That can change your bacterial flora. When you change the bacterial flora, you have dysbiosis, and then you can get an upregulation of the immune system. Antibiotics, just one round of antibiotics can wipe out or really significantly reduce the bacterial imbalance, the balance of bacteria in your gut. And that bacteria can grow back, but whether it grows back appropriately is the problem. And when we're on that subject, even natural antimicrobial substances, herbs and things that we typically use in functional medicine to try and knock down organisms can also be problematic as well. Then we have medications that can produce it, lots of toxins in your food and your water, and the number one toxin we talk about with creating gut problems is glyphosate from Roundup. Glyphosate is an antibiotic, so it changes your gut flora. And if you're constantly consuming processed foods or foods and water that's contaminated with glyphosate, you're constantly creating disruption in the GI tract, increasing the upregulation of your immune system and increased likelihood of developing autoimmunity, allergies, and food intolerances. Then we see increased or decreased exercise. People who don't exercise, definitely that has a role in the health of your gut flora. And those who are excessive exercisers, endurance athletes specifically, you can really create some problems in your gut biome. But exercise has been shown over and over again, as long as it's not excessive, to be very beneficial in normalizing gut flora. Diet plays a huge role, so depending on what you eat determines what kind of bacteria that you grow in your GI tract. And then the last one is disrupted sleep. If you have altered or disrupted sleep, that's been shown in literature and research, it changes your gut biome. And once you change your gut biome, then you can get that upregulation of the immune system, increased likelihood of autoimmunity via loss of self-tolerance, and then increased allergies and food intolerances. All right? So what should you do? 4 things. Eat a whole food diet. That's one of the best things to do. Everybody can start there. Eat more whole foods. Eat less processed foods. 2, if you're going to do probiotics, I really recommend the spore-based probiotics versus just your basic off-the-shelf probiotic. Most of them aren't shown to do what we think they do, but I would definitely recommend more of the spore-based probiotics. 3, limit antibiotics and antimicrobials as much as possible. You can knock things down with these things, but you have to help restore good flora at some point. And whether you're taking an antibiotic on a regular basis or you're taking antimicrobial products from a functional medicine practitioner on a regular basis, those things are going to disrupt your gut flora. And then lastly, see a functional medicine practitioner like myself. Get a functional GI test done. These are functional GI test tells us what's growing in the GI tract. It gives us an idea of acids and enzyme production and the health of your immune system and inflammation in the GI tract. These tests are typically not done in a allopathic practice. If you go to a gastroenterologist, they're not running these tests. What they're running are pathology-based tests looking for disease, and that's okay, but if you don't have a disease, then you're going to get diagnosed with a functional GI disorder, and the only way to really diagnose a functional GI disorder is do a functional GI test, which isn't done in allopathic medicine. All right, so hopefully this helps, and this is part 1 of how hypothyroidism and your gut or how your gut can create hypothyroidism. All right, take care.